Hi everyone, my name's Kate. I'm a fourth year nursing student at the University of Saskatchewan. Today I'm going to be presenting on syphilis. So what is syphilis? Syphilis is an STI or sexually transmitted infection. It's caused by a bacteria. It's spread through unprotected oral, vaginal, or anal sex, through sharing of sex toys, and it can be passed to a baby during pregnancy or delivery. So symptoms of syphilis vary since syphilis developed in 4 stages. The 4 stages of syphilis include primary, secondary, latent or silent, and tertiary. So this is just an image that shows the 4 stages. In stage 1, it's 3 to 90 days after infection. Typically, you may have painless sores present around the mouth, genitals, or anus, depending what type of sex you've had. And the sores can go away without treatment, but the infection will continue to progress to the secondary stage unless it's treated. Stage 2 is 2 weeks to 6 months since infection. Flu-like symptoms typically present at this time, so rash on the hands, feet, or trunk of the body, and a possibility of patchy hair loss. Again, symptoms can go away on their own, but until you are given the treatment, you still remain infected with syphilis. Stage 3 is latent, so 2 to 30 years since infection. Typically, there's no signs or symptoms, but the disease can begin to damage vital body areas such as the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. And this is in about 1/3 of infected individuals. Stage 4 is 10 to 30 years after infection, and it can lead to internal organ damage. So Canadian statistics. The province and territories with the highest rate of infectious syphilis in 2019 were Nunavut, Manitoba, the Northwest Territories, Alberta, and Saskatchewan. I'm focusing more on Saskatchewan because that's where I'm doing school. So Saskatchewan in 2019 had 33.7 out of 100,000 population. This map shows 2020 infectious syphilis rates in Canada. And as you can see, Saskatchewan has increased from that 33.7 I said to 78.4 out of 100,000 people. So a significant increase. The rates did decline between 2019 and 2020 in Manitoba, the Northwest Territories, and Nunavut. But as well as increasing in Saskatchewan, they increased in Alberta. Alberta's increase was less than Saskatchewan's, as they increased from 51.9% to 56.7%, versus Saskatchewan's 33.7 to 78.4%. So syphilis in Saskatchewan, between 2017 and 2021, Saskatchewan's overall syphilis rates have increased by 1,346%, which is an extremely scary number. Between January 1st to June 1st of 2010 and 2022, so the same time frame in 2010 and January 1st to June 1st of 2022, Saskatoon saw an increase in reported syphilis cases, specifically in Indigenous communities. So in 2010, they were at 40. In 2020, they increased to 411. And the main reason this jump occurred is due to a lack of access to care. So COVID really limited the ability for individuals to go get tested or screened. And there's an increased rate of individuals not seeking care if they have faced discrimination in the healthcare system. Specifically, a note of interest here is in 2015, there was an increase around the time Tinder became quite popular. And there was a noticeable difference with higher rates of syphilis in women than men at this time. So syphilis in pregnancy, it's also called congenital syphilis or CS. Congenital syphilis is a syphilis infection passed from a mother to her baby, either during pregnancy or during birth. The potential effects of CS during pregnancy can include miscarriage, stillbirth, premature or early birth, and a low birth weight of the newborn. Not all newborns with CS will have signs or symptoms, but without treatment, serious symptoms can present. These signs and symptoms in newborns can include deformed bones, jaundice or yellowing of the skin and eyes, blindness, deafness, or skin rashes. It's important to note that congenital syphilis is treatable. They give an antibiotic treatment, it's called penicillin G, and the sooner the treatment during pregnancy, the better. Routine screening is completed for expecting mothers at some of their early prenatal appointments to identify any potential infections and provide that early treatment. So this is just a graph of the reported early CS cases in Canada. As you can see, there's a significant spike between 2017, 2018, and 2019. In 2020, the majority, so 86% of all confirmed early congenital syphilis cases that were reported were observed in Alberta, Manitoba, and Saskatchewan. And these provinces also had the highest rates of infectious syphilis among females aged 15 to 39. So that's in 2020. So testing and treatment for syphilis, a diagnosis is made through testing, which can include a physical exam, a swab of any open sores, and or a blood test. And treatment is through a dose of antibiotics. It is treatable. The treatment, however, cannot undo any damage caused by late stage of syphilis, but it will prevent the infection from causing further problems because it will treat it. Just an important note with treatments, the number of doses of antibiotics depend on what stage of infection an individual is at. According to the CDC, a single dose of penicillin G cures the early stages of syphilis, but the recommendation is 3 doses of penicillin G at weekly intervals for late or latent syphilis or any treatment of a syphilis of an unknown duration. So risk factors for syphilis. So we kind of split it into 2 underlying and proximate determinants that lead to syphilis infection risk. Under underlying, it has the demographic factors. So that's like your sex, your identity, or your gender identity, your age, ethnicity, or cultural background. For socioeconomic, it kind of splits into 4 key areas. So employment status, income, housing stability, or education. That all filters into your socioeconomic status, which can lead to safer sex, health service access, or resource access. Physical environment. So syphilis is rising in certain rural communities. And there's an increased risk of syphilis in incarcerated individuals. Social norms and sexuality. So the introduction of hormonal contraceptions in the 1960s led to a decreased use of barrier methods, which includes condoms. Dating apps also have correlated to a higher number of sexual partners, and the view that syphilis is treatable, so it's not a major concern. The health system's policies and guidelines more so discuss the idea of screening, having sexual education, which is decided on a provincial level. Under proximate determinants, we have violence, discrimination, stigma, which entails individuals who have experienced intimate partner violence are 2 times more risk for reporting syphilis. This is just due to decrease or no negotiation of condom use. Individuals who have faced healthcare discrimination are 4 times the risk of reporting syphilis due to a reduction in seeking regular STI screening. Mental health and substance use. So mental health relates to that low self-esteem and low efficacy in negotiating condom usage. Problematic alcohol use, so more than 14 drinks a week, can have an increased risk for a positive test for syphilis. And other substances linked to increased risk can include cocaine, crystal meth, or injection drug use. Sexual activity and behaviors. So condom usage, the number of sexual partners, venues, in public venues, sex is related to inconsistent condom use, or sometimes a higher number of sexual partners. And clinical factors include an HIV co-infection. So HIV infection can impair syphilis clearance, which can lead to more rapid progression of the syphilis stages, resulting in complicated treatment. So prevention, my beautiful picture of all of the condoms. We kind of split prevention into a couple categories, but the main ones I'm going to focus on are primary and secondary. Primary prevention talks about interventions used before health effects occur. So before anyone is infected with syphilis, what can we do? Like, we can provide free condoms. We can provide health education, vaccinations, more so for HPV. Syphilis does not have a vaccination. Secondary prevention talks about identifying the disease that's already present, but it's not symptomatic. So getting routine STD or STI screening and testing. So overall prevention, like I talked about, sexual education, increases knowledge on STIs, safe sex practices, and when and why to get tested for STIs. Condoms, in this image, when used properly, this is not properly, but condoms act as a barrier method to reduce the risk of transmission of STIs. And finally, screening, so getting blood work or giving a urine sample to test for STIs. Technically, it's a secondary prevention method, but it identifies results possibly early on to allow for treatment to be initiated. So testing recommendations. This is a bit of a lengthy list. Ultimately, there's no wrong time to get tested, even if it's just for your own peace of mind. But these recommendations are, if you're in a committed monogamous relationship, it's recommended you get tested once a year. If you're entering a new relationship, it's recommended you get tested after any new partners. Depending on what type of relationship configuration you have, if you're in an open or poly relationship and you're engaging in sexual activity with multiple partners, it's recommended you get tested more often. So that one kind of relates into the every 3 to 6 months if you or your partners have other sexual partners. It's also important to get tested if you notice any changes in your body, if you have sex with somebody who has an STI, or if you had sex without a condom, or if a condom breaks. So just a quick overview. What is syphilis? It's an STI, or a sexually transmitted infection. It's spread through unprotected oral, vaginal, or anal sex, through sharing of sex toys, and it can be passed to a newborn during delivery or to a baby during pregnancy. Syphilis develops in 4 stages, which have different symptoms present for each. What is congenital syphilis? It's a disease that occurs when syphilis is passed from a mother to her baby or newborn, either during pregnancy or birth, and it can have significant negative impacts during pregnancy and on newborns. So why are the rates so high in Saskatchewan? They're significantly increased due to a lack of access to care, discrimination in the health system leading to decreased rates of seeking care, or the view that it is a treatable STI. So there's no need to use protection. Testing and treatment. Testing is done through a swab of an open sore or a blood test. And treatment is a dose of antibiotics. Again, the dosing varies depending what stage you're at within the syphilis progression. And then finally, how to protect yourself and others, practice safe sex, use condoms, use dental dams, and then get tested and just know your status. And these are my sources.